I'm Angie Masden, and I am giving my informative speech today over toothbrushing and flossing. Even though we've been brushing and flossing our teeth for years and years, many of us are surprised to learn that we are not doing it correctly. Case in point, did you know that proper brushing takes at least 2 minutes? Most adults do not come close to brushing that long. 7 steps for better brushing. Place your toothbrush bristles at a 45-degree angle to the gum line. Use just enough pressure to feel the bristles against your gums and between your teeth. Don't squish the bristles. Brush all inner and outer tooth surfaces several times using short, circular strokes and a scrubbing motion. Be sure to brush along the gum line as well. Brush chewing surfaces straight on. Clean the inside surfaces of front teeth by tilting the brush vertically and making up to down strokes with the front of the brush. Your toothbrush can only clean 1 tooth or 2 teeth at a time. Move your brush frequently to reach every tooth and make sure you brush for 2 minutes. Watch yourself in the mirror to make sure no tooth is left behind. After brushing teeth, remember to brush your tongue. Oral bacteria can remain in taste buds. Research suggests that the exposure to acidic foods and drinks during meals softens the enamel of your teeth. Brushing your teeth immediately after consuming acidic foods and drinks increases the chance of enamel erosion. To help prevent dental erosion, drink or rinse with water immediately after eating or drinking. It is recommended that you avoid brushing for at least 30 minutes after eating or drinking acidic foods or acids, or better yet, brush your teeth before consumption. Brushing twice a day for at least 2 minutes helps to remove food particles and dental plaque that can damage teeth and gums over time. Flossing daily helps to remove food that's stuck between crevices or between teeth, and also plaque, which can severely impact your oral health if persistent. 5 steps for fabulous brushing. For fabulous flossing. Start with 18-inch of floss. Wind most of it around one of your middle fingers and the rest around the same finger on each of your hand. Hold floss tightly, about 1 inch of floss between your hands. Glide floss between teeth with a gentle sawing motion. You'll feel resistance when the floss reaches your gum line. Gently curve it to a C against your tooth. Hold the floss against each tooth, gently scraping the tooth side while moving the floss away from the gum. Repeat on all teeth. Don't forget the back ones. Be brave. If you haven't flossed recently, your gums may be sore or bleed. Don't worry. After 5 to 6 days, you'll remove the buildup bacteria and your gums will feel great. Rinse to refresh. Once you finish brushing and flossing, rinse your mouth vigorously to remove any loosened plaque or food particles. Periodontitis, also generally called gum disease or periodontal disease, begins with bacterial growth in your mouth and may end, if not properly treated, with tooth loss due to destruction of the tissue that surrounds your teeth. What's the difference between gingivitis and periodontitis? Gingivitis, gum inflammation, usually precedes periodontitis, gum disease. However, it is important to know that not all gingivitis progresses into periodontitis. In the early stage of gingivitis, bacteria and plaque build up, causing the gums to become inflamed and to easily bleed during toothbrushing. Although the gums may be irritated, the teeth are still firmly planted in their sockets. No irreversible bone or other tissue damage has occurred at this stage. When gingivitis is left untreated, it can advance to periodontitis. In a person with periodontitis, the inner layer of the gum and bone pull away from the teeth and form pockets. These small spaces between teeth and gum collect debris and can become infected. The body's immune system fights the bacteria as the plaque spreads and grows below the gum line. Toxins or poisons produced by the bacteria in plaque, as well as the body's good enzymes involved in fighting infections, start to break down the bone and connective tissue that hold the teeth in place. As the disease progresses, the pockets deepen and more gum tissue and bone are destroyed. When this happens, teeth are no longer anchored in place, they become loose and tooth loss occurs. Gum disease is a leading cause of tooth loss in adults. What causes gum disease? Plaque is a primary cause of gum disease. However, other factors can contribute to periodontal disease. These include hormonal changes, such as those occurring during pregnancy, puberty, menopause, and monthly menstruation. Makes gums more sensitive, which makes it easier for gingivitis to develop. Illnesses may affect the condition of your gums. This includes diseases such as cancer or HIV that interfere with your immune system. Because diabetes affects the body's ability to use blood sugar, patients with this disease are at a higher risk of developing infections, including periodontal disease and cavities. Medications can affect oral health because some lessen the flow of saliva, which has a protective effect on teeth and gums. Some drugs, such as the anticonvulsant medication Dilantin and the anti-angina drug Procardia and Adalat, can cause abnormal growth of gum tissue. Bad habits such as smoking make it harder for gum tissue to repair itself. Poor oral hygiene habits such as not brushing and flossing on a daily basis make it easier for gingivitis to develop. Family history of dental disease can be a contributing factor to the development of gingivitis. Tips for healthier teeth. Choose the right tool. Just any old toothbrush may not be the one for you. Think about the size of your mouth. If you are straining to open wide enough to let the brush in, the brush is probably too big. It should feel good in your mouth and in your hands, so you'll use it often. Know your bristles too. If they're really stiff, they can hurt your gums. A soft brush is best. Electronic or manual is an individual preference. It's not the toothbrush, it's the brusher. Electronic toothbrushes can make it easier to do a better job, especially if you have arthritis or other trouble with your hands, arms, or shoulders. Give it time. Are you brushing enough? Twice a day is recommended, but 3 times a day is best. It should take at least 2 minutes each time. It is suggested that you divide your mouth into 4 sections and spend 30 seconds on each. Some electronic toothbrushes have built-in timers and can track how you're using it by syncing to your smartphone. Don't overdo it. Brushing more than 3 times a day might not be ideal. That's because too much can wear down your teeth's outer shell called enamel and damage your gums. Also, don't bear down too hard. Use a light touch. If you use an electric brush, you let the bristles do the work and just guide the toothbrush. Be gentle. It does not take a lot of force to remove the plaque. Pick products wisely. The kind of toothpaste you use matters. The ones that brighten or control tartar can be too harsh. An increase in whitening particles can be harmful and sand away tooth structure. Go back to plain old fluoride toothpaste. If you want to lighten your smile, you can always switch between whitening toothpaste and regular. Control your sour tooth. Energy drinks, diet sodas, and sour candies, even healthy things like apple juice, orange juice, and coffee, have acid that can soften your tooth enamel. If you do go for that stuff, wait half an hour before you brush. That gives the saliva time to restore your tooth enamel. The mechanical action of brushing softened teeth is a perfect recipe for wearing away enamel. Avoid potty mouth. Most of us store brushes in the bathroom, not the cleanest place in the house. To keep yours tidy, stand it up in a holder. If you leave it on the counter, you could expose it to germs from your toilet or sink. And don't let 2 brushes touch each other when they're stored together. Let yours air dry. A moist brush is more likely to grow bacteria. Use a cover that lets air in when you travel. Let it go. How old is your toothbrush? You should get a new one every 3 to 4 months. Also, give it the eye test. Once the bristles lose their normal flexibility and start to break apart, change your toothbrush. Frayed or broken bristles won't clean as well. If you can't decide which toothbrush to buy, ask your dentist which is the best. The time is now. When it comes to preventive care, there is no bad time to dive in. Dentists recommend brushing at least twice a day and flossing at least once. Consider adding extra sessions after high carbohydrate meals or snacks, sweets, or sugary beverages. Go Pro. In addition to flossing and brushing, twice a year dental cleanings are an important part of maintaining your oral and overall health. Call your dentist today and schedule your appointment. The sources I have used are deltadental.com, colgate.com, and webmd.com. Thank you.